Self-Medication, Terminology of Blame and Judgment, Part 1, by alipinkandgreen.com, the 6th of July, 2025. Self-medication. A term almost always referencing choices, illegal or frowned upon by many or some within society, often accompanied by a strong preference towards advice to do less of whatever you shouldn't be doing, woeful knowledge of addiction for starters, rather than a serious effort to examine reasons. To me, these are some significant failures in British medicine: historical, environmental, psychosocial contexts, all fundamentally relevant to health and behaviors, yet largely unexplored. Organs and biological mechanisms continually impact one another. Investigating and viewing them independently makes no scientific or logical sense. Conveyor belts of people given treatments with effects likely to result in another health problem isn't effective treatment. It's medically approved deterioration. With personal experience of pharmaceutically induced issues, plus how brutal withdrawal from prescription drugs usually is, my views on medication are likely to differ from someone with no significantly bad experiences. I'd consider accessing cancer treatments, but very reluctantly, given my previous encounters with oncology have been overwhelmingly damaging to at least my mental health. Though certainly not the only example of this therapeutic breakdown, I will never, ever forget my distress and frustration at not being heard when I was trying to explain that gold standard treatment, or not, an operation resulting clinical menopause, was something I wasn't comfortable with at all, given that with the neurological condition, I have many unpleasant symptoms already. With my tumor markers low, I was prepared to gamble. It was benign this time. I wasn't heard when I said the pressure to go this route, and clerical mistakes and miscommunication had, alongside other issues, driven me to my deepest depression for years. Only when I was shouting and crying on a ward, despite all the antidepressants I was now on, was I finally heard and treated like a person and not a body part. Unfortunately, the pharmaceutical domino model I described earlier leaves me with no reason to doubt my experience would be different in another department. Another department's problem is no consolation to the patient, the person you gambled with. I've long believed it misguided for cannabis to be placed in the hands of medicine. It can't be measured in the same way as pharmaceuticals, yet we collectively lack imagination to accept this and approach it differently. Lavender, chamomile, and many spices like turmeric have known therapeutic medicinal properties, but they've not been embraced by healthcare, private or publicly funded, and their regulation isn't constantly meddled with. I'd largely assume that's because they don't get you high, because successive governments seem to think that with the inequality and unrest in Britain, that's the biggest problem. Give your head a shake, elected folks. You don't honestly believe that reefer madness nonsense, do you? I assure you, my life is still not that exciting. Discrimination against cannabis means that even where it can be, to a reasonable degree, measured like for like with pharmaceutical alternatives, it very obviously is treated more unfavorably. Though far higher with synthetic cannabinoids, risk of death, even indirectly, seems exceptionally low. One compared to many prescribed drugs, and indeed alcohol. If medicalization guaranteed treatment irrespective of wealth, that would be a strong argument, but it isn't. So, self-medication as a tool of blame and shame in a clinical context surely raises the questions: are doctors our ethical and legal guardians or caregivers? What connotations does that have for patient care? I'll examine some reasons I feel this conflicts with effective patient care and therapeutic relationships. I've said before and will again, I've encountered loads of excellent clinicians and professionals, of various disciplines I still do, but this article is about the systemic damage, intentional or not, that conflicting roles and priorities might inflict, and an individual right to choose. Reason 1. Why is it assumed we only make bad decisions? The gateway drug argument. People selling hard drugs and cannabis, which not all cannabis suppliers do, of course, will make the former easier to obtain, and numerous reasons might lead people to try other substances. But by the same token, why would I want to move from cannabis to something that works in different ways and will do different things? I have severely disabling symptoms that reduce my functioning immensely. Why would I want to make that worse? People might be taking cannabis to mask voices rather than causing them. And I'll grant you that insight is often absent in people experiencing psychotic breaks. But that doesn't mean they're always wrong, or that they shouldn't be listened to. Or those taking speed to improve their concentration, cocaine to increase confidence. None of these are in any way recommendations, by the way. Social and healthcare departments might actually know how much therapy and work many of us have done if there was a cooperative, interactive system with regards to communication. This would be offset to a degree by the misinformation/misinterpretations within those notes, by those whose preconceptions made them unable to accurately convey what was said or not said. As sick and disabled people are likely to be short of money, it seems strange to assume they'd spend on something they didn't believe they needed. Ironically, if my bad choice and reason for poverty was gambling, it's unlikely anyone would have even asked and found out. How surreal it must feel for parents giving their children cannabis oil when they're treated like they're negligent, ignorant, irresponsible, self-medicating by proxy, as it were. It defies logic. An expensive way to be abusive, you'd think. They go to Parliament and the papers, for goodness sake. I'd imagine many or most parents of epileptic children have video evidence of cannabis working too. I've seen loads of these myself. I've posted my own. Cannabis was just as effective before I got the respectability, depending on who you talk to, of a prescription. Illicit didn't have testing certificates, but it worked, or at least the right stuff did. Reason 2. Oversimplification alters reality. People are complex and unique. We experience different things in entirely individual ways. Yet there seems a natural tendency to reduce everything to something simpler, perhaps so we can interpret it in a way that works for the most thought processes. I'd argue a significant shortcoming in this approach is that by doing so, we reduce everything to generalizations which might fit some reasonably well, but certainly not all, possibly not even many. If that isn't acknowledged, you're surely not able to adequately help those who present differently. I lost interest in statistics after having a cancer they didn't think it was and developing a rare disease. Medically speaking, I almost certainly fit some generalizations. I'd imagine we all would, but I defy plenty. I also lost patience with having concerns over surgery dismissed as, "That's unlikely to happen." So was what happened already, mate. Everything you see is seen for the first time once. There's also an assumption amongst many people that they can completely understand or grasp a person's hardship simply by thinking about it, albeit often not for long, without any comprehension that that is impossible, because they're only viewing it from their own life perspective. So, on to alcohol. Only a species as bonkers as us would select a depressant as the most consistently legal pleasure-seeking drug. It's often said that alcohol destroys lives, but it's consequences of how and when people imbibe it that does that. Alcohol in itself isn't destructive. As we're routinely asked how much we drink in a GP consultation, I've known people disbelieved for saying too little or much, according to the preconceptions of the documenting clinician. So you still can't guarantee what you said is what's written. Are our answers arbitrary then? Where and what and why your drinking matters? You'll almost certainly be judged if you're drinking too much, perhaps asked why. There are plenty of places where you can get cheap doubles or lower-priced pints. The tax office probably won't judge you for going in them either. If you need help, on the other hand, whether there's support in your area and your doctor knows about it is another question again. The postcode lottery. Do they view it as a health and social issue worthy of help? or a moral failing worthy of disdain. You likely won't be asked how much you drink of the currently more apparently fashionable coffee, despite the fact excess of that could give you palpitations, racing heart, and would send my movement disorder berserk. I don't remember my healthy diet being something worthy of much time in these settings, nor congratulations for having always exercised. I do know one person of more advanced years who has been treated like a confused old dear more than once because they couldn't possibly not be on medication by their age. The end of part 1. Thank you for listening. Click the link in the comments to open part 2.